arrangement.
I wanted to talk about and something that you and I had talked about earlier, and I had also talked to Mr. and Mrs. Ceballos regarding the requirements for state and city license. And can you give me a little bit more information about that? So, like for example, if I was looking for a foster home for my mom, my grandparents, what is it, some of the things as far as a license that you would recommend to caregivers out there or clients that they look for?
The purpose of a license is to ensure that we follow the guidelines and regulations of city and state as they're written. Now, in this type of facilities, we are allowed two different types of certifications. One will be a licensing by the city, which is a license that is provided to ensure that the safety codes are kept, that the minimum standards of personal care are kept, and that the facility is fitted to handle those kind of residents. That's a city license. It has a limitation of 3 to 4 people living in the facility, or if it is a personal care, 5 to 8 people. Now, moving along those guidelines, we have the state license facility, which is a larger facility that provides care to recipients of programs such as CBA, BMBB here in town, or some other Title 20, I believe, that is going to start providing services to foster homes. I think there is talks about moving this to a different type of functioning, where CBA was providing services for Type C foster homes. Now it's going to be turned over to private companies that will be providing.
So, and just to the general public out there, CBA is under the Texas Department of Human Services, correct?
Correct.
And CBA provides, and this is for mainly lower income, you have to meet a certain income requirement to qualify for CBA.
Exactly.
Right? And I just want to, so, people that are out there wanting to find out what is CBA, it's actually for, to provide homemakers.
Yeah. First of all, CBA stands for community-based
Based-
maternity. That's
correct.
for people that don't want to live in nursing homes. Let's say, for instance, someone is in the hospital and is given a choice and says, well, you're going to have to move to either a nursing home or to another facility. And he says, well, but I don't want to leave home. And he's offered the services of CBA.
Okay.
That's the first intention. But then if he doesn't have anybody at home to take care of his needs, he's going to have to go or to move to a certified home through CBA where he can get those services. Okay.
Is Loma Verde going to be operating under private?
Well, to begin with, it's going to be a private facility, but the idea is to certify it through the first stage, which is Type A facility.
Can you give me what is a Type A facility?
Type A facility is an assisted living facility that is small.
Okay.
Could have anywhere from 1 to 16 residents, and basically what they can provide is services to people that are mostly independent.
Okay.
And they will get a state license after the certification process as a Type A facility. In this case, Loma Verde could accommodate up to 8 people,
Okay.
8 beds, and work under any state program that is available to the residents.
Oh, good.
Okay. If they wanted to go further up to a Type B facility, provided there was a nurse on duty during daytime hours and on call during nighttime hours, then they could get residents that are bedridden, they have G-tubes, they have more nursing needs, function as a Type B facility. Okay.
Foster homes, and something that like I've been in the industry. Good Nekti, who works for a home health agency, we were talking to me. She was like, "How long have you been doing providing senior services?" And so I've been doing this for 15 years, and she works for a home health agency also. And one of the things that I will tell you is that looking at working with foster homes that are licensed and qualified to provide is really the care that they give, and I've worked with you in the past, is I think they get better care for clients that are in a foster home setting, because on the one-on-one care, that is being provided to the quality, to the client, and the quality of care is also better. Even cost. Most recently, I had a family that had called me and asked, was going to go on hospice, and they were in a nursing facility paying privately out of pocket to be in the nursing facility. And I think, don't get me wrong, and I remember talking to the patient's daughter. I think they were going to pay like $5,000 just to be living in the nursing facility. At that point, I had taken the patient and I said, let's look into. They were going to looking at different options, and they went into foster home. They wanted to look more at foster homes in the facility in the community, and I found that there was a big price difference of the cost of the care for their loved one. Do you find that to be true yourself?
Yes, it is. And another thing that I wanted to mention, you mentioned nursing homes. In a nursing home facility, the ratio of care will be 1 to 10 approximately. That means 1 attendant is going to be taking care of 10 people on average. In a foster home, it's 1 to 2 or 1 to 4. And of course, the difference in care is tremendous. Now, when it comes to cost, you're talking about a 30 to a 50% difference in cost. So coming to a foster home is sometimes more convenient when the person is going to be paying privately, out of pocket. If they were going to get the services to Medicare or to Medicaid, maybe a nursing home will be the appropriate place to go. But when it comes to, and there is only certain days that are allowed under Medicare to be in a nursing home. I believe nowadays it's something like 2 weeks or at the most 30 days. It used to be 3 months a long time ago, but that's way back. Nowadays it's very, very short period of time, just giving enough time for the resident to recuperate, and then after that they have to pay privately. And that's why a lot of times the families get to a point where they want to have an option that is a little bit more affordable to continue having their loved ones in facilities that where they can get the services that they require.